Welcome to day 5, aortic valve options in aortic valve stenosis. Today we're going to talk about a special circumstance, aortic valve stenosis in the presence of ascending aortic aneurysm. Now what does that mean? Well, your heart is connected to a pipe called the aorta. Part of it goes up, the ascending aorta, part of it arches, the arch of the aorta, and then the third part descends, called the descending aorta. It descends down your body to then split off and provide blood supply to your arms, your legs, and various other organs in your body. Now, this is the first part. There's your heart. The first part is called the ascending aorta, and inside there is where your aortic valve sits. If you've got aortic valve stenosis and this part of the aorta is enlarged, you have got aortic root enlargement, and in this setting there may be an indication for you to require not only aortic valve replacement but replacement of the aorta too. We call this aortic root replacement. Now there's a special circumstance where this might really happen, and that is in the setting of bicuspid aortic valve. In other words, your aortic valve is made up of 2 leaflets instead of the traditional 3 leaflets. And in this setting, we would look very carefully to ensure that you have not got evidence of early enlargement of that ascending aorta, because if you have, it is very likely that if all we do is replace the aortic valve, you will get an aneurysm of the ascending aorta later in life and you will need repeat surgery. We would like to deal with it all at once. Now, the size of that aorta depends upon the type of valve you've got, and also your particular size. Suggesting dimensions on a video is not the correct thing. But I think the thing I would like you to remember is that if you have got a bicuspid aortic valve, you almost certainly need a CT scan to ensure that you have not got associated enlargement of the ascending aorta. If you have got a 3-leaflet valve and your doctor's told you that you've got enlargement of the ascending aorta, then in both those circumstances you might need an aortic root replacement. Now this procedure can be performed through a keyhole operation, and it can be performed very successfully. There are slightly different options in this setting. If you are young and you choose a mechanical valve, then we would be able to put in a traditional mechanical valve, or indeed the carbon onyx valve, placed inside a man-made tube, so we replace both the valve and the ascending aorta with the man-made cloth tube. If you choose to have a tissue valve and you need an aortic replacement and aortic valve replacement, then you have one other option, and that is to choose aortic root replacement with a xenograft root or a homograft root. Now, what on earth does that mean? A xenograft root is quite simply a pig's aortic valve inside the pig's aorta as a little pipe. And that xenograft can be used to replace both your aortic valve and the ascending aorta all in one go. The beauty of this is that durability of this replacement is far better than any tissue valve that we currently use in clinical medicine. We'd expect that over a 20-year time frame, you might have a durability with this valve of more than 90%. You'll never get that with a tissue valve, particularly when you're young. Now, a homograft is pretty much the same thing, but instead of coming from a pig, it comes from a human. Now, they're both great. The problem with the homografts is that depending upon the size that you require within your heart, the quality of the homograft may or may not be good enough. Particularly if you have larger sizes, the homograft quality begins to deteriorate. The beauty of the xenograft is that we can have on the shelf multiple sizes, and we can choose exactly the one that's right for you, and they will all be of a very high quality. So currently we prefer to use the xenograft route when we're doing an aortic root replacement. Just to remind you, an aortic root replacement is a replacement of not just the aortic valve but also the ascending aorta. So if you want a tissue valve, the xenograft route is our preferred choice. And if you prefer a mechanical valve, then the onyx valve route is a very good option, because it means that after 3 months you can reduce the amount of warfarin that you need to take, but you do need to take aspirin with it, if you remember video 1 on day 1. So a quick summary, there's a lot in there. If Your doctor has told you that you have a bicuspid aortic valve, then you need a CT scan to ensure that you have not got associated aortic enlargement. If you have, you need an aortic root replacement. If your doctor has suggested that you've got a 3-leaflet valve with enlargement of the ascending aorta, you may also require an aortic root replacement. If you require an aortic root replacement, you can have that replaced with a mechanical valve inside a tube conduit which replaces the aorta, or you can have a tissue valve option. And in this setting, the best option for you is either a xenograft root replacement, a pig's root, or a human root called a homograft.